If you suspect you have a seronegative autoimmune disease or you have been diagnosed with a seronegative autoimmune disease, this video is for you. I have an analogy that I know you are just going to appreciate, and then I have a statement for you to use if you are undiagnosed and you are fighting for an official diagnosis, but you just can't quite get there. I understand how it feels. Hi, I'm Christina. I'm a board certified patient advocate, and I have not one, but two seronegative autoimmune diseases with Sjogren's and myasthenia gravis. So I was recently working with my neuromuscular neurologist, and he was asking me why it took so long for me to get diagnosed with Sjogren's. I explained to him that I had a barely positive ANA and barely abnormal or positive anti-centromere antibodies, and that's all the providers would focus on. I just don't have the traditional SSA, SSB antibodies. I was refused further testing for that reason. And he looked me dead in the eye and he said, yeah, I have a lot of colleagues who just refuse to acknowledge seronegative conditions and will not diagnose it. And it just makes my blood boil. And we had a conversation about how wrong that is, because it's not that there's scientific evidence that that patient shouldn't be diagnosed with that. The science is actually missing because we haven't discovered all of the antibodies yet to associate with RA or Sjogren's or myasthenia gravis or whatever autoimmune condition it may be. To me, this is the analogy that I want to share to you. It feels like a puzzle. You laid a puzzle out on your dining room table, you did the whole entire thing, and you're missing one puzzle piece. And a doctor walks by and you're like, this is a puzzle, right? And they look at, instead of looking at the whole thing, looking at all the puzzle pieces and saying, looking at the full picture and saying, yeah, duh, that's a puzzle. They zero in on that one missing puzzle piece and they can look right through to the dining room table and they say, there's nothing there. There's nothing there. That's not a puzzle. You need to move on with your life, find another hobby. They just focus on that one missing piece. And in my case, that missing piece is probably just being chewed by my dog in the corner. But in terms of medicine, it's just because we haven't discovered that missing piece yet. So as a board certified patient advocate, I'm going to give you my sort of spiel statement that I would say to providers when they ask me, why does a diagnosis matter? Why is a diagnosis so important to you? I would tell them, a diagnosis is extremely important to me. I have a right to know what is going on with my body, and a diagnosis is not just a label. I am seeking information so that in case my symptoms change or I'm in an emergency, I will be able to pivot faster with a diagnosis. I will have access to more referrals if I need them with a diagnosis. I will be able to combat insurance issues more likely with a diagnosis. Not to mention that I also have validation for the debilitating symptoms that I have been experiencing, and I have a way to communicate with my friends and family what is happening with me. Are you willing to work with me on this evaluation to completely confirm or rule out XYZ autoimmune disease? And if they say no, then you say, good day, sir. Good day, ma'am. And you move on to the next provider. It took me 3 rheumatologists to even get a lip biopsy that would confirm Sjogren's, and then a 4th to get an effective treatment plan. And now I'm feeling the best that I have in 5 years. So don't lose hope. I know it's frustrating and time consuming, and it just feels like you're on a hamster wheel, but take breaks when you need to, but then battle on another day. And I am really hopeful that you can get to the other side like I did.